Several conditions require an evaluation in cardiogenetic. First, different types of cardiomyopathy or heart muscle disorders. These include hypertrophic cardiomyopathy, some form of familial cardiomyopathies, and arrhythmogenic right ventricular cardiomyopathy. There are also some electric problems of the heart that require an evaluation. These include the Brugada syndrome, long QT syndrome, among other arrhythmic problems, and also some forms of familial sudden death. There are also some cholesterol problems that need evaluation, as well as some aortic problems. During a consultation in cardiogenetics, you usually see different people. First, we are a group of doctors working together with different specialties. There are also genetic counselors working with us, as well as some nurses specialized in cardiogenetics. The first part of the consultation is going through your medical history and the tests you already had, and see if other tests are necessary to come up with a good diagnosis. Then we go through your family history, which is very important in the case of cardiogenetics. This includes building a family tree or pedigree, and we put a lot of care in finding out about cardiac diseases, early cardiac diseases in the family, as well as cases of sudden death. Then we go through the treatment, see if medications are necessary, and in some rare case, if, for example, a defibrillator would be indicated. Then we discuss about the disease. We answer your question, and we see if some preventive measures should be done. The last part is the family screening. We make sure we know who should be screened about the disease in the family and how we should perform this screening. Sometimes you will be approached for some research projects or being part of a registry about your disease. This is always optional. Genetic testing is a blood test, specifically looking at DNA. DNA is basically the instructions to build proteins in your body for every organ, including the heart in the case that interests us. So by doing this test, we are able to see if some genes involved in the function of the heart is affected. The genetic testing can be ordered for different reasons. It can help us with your diagnosis, can help us sometimes to guide the treatment, but it can also help us to screen other members of the family. In your case, if we think that genetic testing should be done, this can be performed after your visit. So the blood test can be drawn after your visit at the genetic clinic, and then this blood test gets sent to a molecular lab for analysis. This result takes about a few weeks to a few months to be available, depending on the cases. So family screening for genetic diseases is important, mainly to prevent complication in your family members. In some diseases, knowing more early about the disease can prevent complications such as heart failure, arrhythmia, and even in some cases, death. The screening of the family can be done in two ways. First, if the results of the genetic testing are positive in a patient, this can be used to screen other family members. If we don't have a positive result to one of these tests, we can perform regular tests such as blood tests, electrocardiograms, and cardiac imaging tests to see if someone is at risk or affected by the disease. If you want more information about cardiogenetics, or if you think you might be affected by one of these diseases, you should contact your doctor or your cardiologist.